Today, we'll hear from leading doctors, medical professionals, and community leaders about their work to increase vaccine confidence and uptake, and why these leaders believe it's important that trusted messengers like pediatricians, physicians, and other healthcare providers are proactive in reaching out to patients and communities with vaccine information routinely. I double as a mom of young children, so I know firsthand how important it is for parents, especially right now across the country, to have the opportunity to engage with community leaders about vaccines. Soon we'll hear about the progress we've made and where there's more work to be done, particularly when it comes to groups we want to see step up more, such as children, teens, young adults, and breastfeeding moms. There are so many choices parents make all the time, but as a parent myself who has nursed a little one amidst the pandemic, I know, based on all of the medical expertise we have here in the Zoom room today, how critical vaccines are. But before we turn to our first panel, it is my pleasure and deep honor to turn to Health and Human Services Secretary Javier Becerra. Secretary, over to you.
Sarah, thanks, and hello to everyone. Thanks for joining us at this first-of-a-kind summit that's focused on increasing confidence in the use of the COVID-19 vaccine. May I begin by thanking the panelists, speakers who will be joining us today, as well as all of you who are watching from home. Many of you have been working day to day in this outreach effort that we have to reach our communities with accurate, life-saving information about COVID-19 and the vaccines that work against it. Our frontline workers, our doctors, our nurses, community health workers, nonprofit partners, faith leaders, many, many more, you've all been crucial in easing concerns and increasing confidence in the vaccine. Because of this work, we're proud to say that today, about a year after the vaccines became available to all adults, 219 million Americans have now been vaccinated. But we know there's more work to be done, especially when it comes to our children, our youth, our young adults, pregnant people, and nursing mothers. Since the pandemic began, about 1 in 6 of our under age 18 population in the U.S. has been infected by COVID. Over 100,000 have been hospitalized, and nearly 1,500 have died. This is preventable. COVID vaccines have been proven to be effective against hospitalization and death. And we know that the most effective messengers in delivering that message are your personal doctor, your nurse practitioner, or other health providers. That's why it's so important that our nation's physicians, pediatricians, community health workers, and others in the healthcare field step up to play the proactive role we need to reach out to your patients, our families, and make sure that the broader community is encouraged to get themselves, their children, and their loved ones vaccinated and boosted. Today, you're going to hear from leaders from some of our nation's largest and most influential medical groups, the AMA, the American Medical Association, the American Academy of Pediatricians, the American Nurses Association, the American Academy of Family Physicians, and many more. But before we go there, I want to first introduce to you Dr. Cameron Webb, White House Senior Policy Advisor for COVID-19 Equity. He's been working hard on making sure we reach everyone. So if you don't mind, let me ask him a few questions and we'll go from there. Dr. Webb, thanks for joining us.
Thanks so much, Secretary Becerra. And it's great to be with all of you this afternoon. And before we jump into the questions, it's striking to me how I look back to what I was doing before I joined this administration as a senior policy advisor for equity on the COVID response team at the start of the Biden-Harris administration. Because prior to that, I was working on the front lines as an internal medicine doctor in my hospital here in Central Virginia. I remember in March and April of 2020, as COVID patients started to show up in our hospitals, how concerning and how challenging that was. But I also remember in December of that same year, how much hope we had when we started to get vaccinated. I remember my colleague, Dr. Ebony Hilton, and my colleague, Dr. Tyson Bell, who both were the first two folks at the University of Virginia to get vaccinated, sending a message to the community as providers, really setting the agenda and saying these vaccines are safe, they're effective, they work, and they're going to help us save lives. And we've been carrying that message forward ever since. And while there were about 19 million folks vaccinated before the Biden-Harris administration started, we've had about 200 million more people vaccinated since then. So we're really excited about the progress that we've made. It's been critical. And I think that as we move forward, as we're entering this next phase of the pandemic, as we're in this next phase of the pandemic, preparedness is critical. We tell everybody, make sure you've got masks available to you in case you're going to need them. Make sure you have tests available at home so you can know whether or not your cold, your stuffy nose, your runny nose is COVID-19. We encourage folks to know whether or not they would be the kind of person who would benefit from the treatments, the therapeutics that we have. But importantly, we don't forget these vaccines have saved over 2 million lives already and are really critical in our fight to continue to move forward and keep people safe. And that's all people in all communities. So Secretary Becerra, I'm excited to be with you this afternoon and excited for the conversation we're going to have today.
Dr. Webb, let's get right into it. Let me ask a question about reaching folks. We know at HHS that we have to go where people are, and that's the way we've been successful in reaching communities that have often been left behind. But now the whole approach to COVID is changing because we're now looking more at severity than just the number of cases, so we can really target those who need our help. Question for you. How do you see this, and what are you prioritizing now and over the next several months to ensure that we keep the fight against the pandemic going and keep Americans safe?
Well, we still know that every single day there are still folks losing their lives to COVID-19, and every single one is tragic. But that number is much smaller today than it was, say, even a year ago. And that's because of the effectiveness of the vaccines. One thing that we've learned is that while we still see cases, not all of those cases are being recorded in settings in communities because a lot of people now have access to the at-home tests, like the ones we've been passing out from the administration by folks going to covid.gov and ordering those tests. And so while we can't capture all the cases, we know that hospitalizations are a good marker for the number of cases that we have. And that's how CDC is going to change the way that it's tracking. That's how they created the COVID community levels, measure. And that's been really helpful for us in tracking what's happening. So right now, things are certainly much improved than they were at the peak of the Omicron surge, but we're keeping a close eye on hospitalizations, both as a marker of disease severity, but also to give us a sense of how that resource, our providers, is being stressed at any point in the pandemic and when and where we may need to surge additional resources. So lots of different metrics. Sometimes people ask, well, what do you do without cases data? We still look at things like wastewater. We look at things like symptom surveys. We look at other sources of information. Google searches about how often people are looking for COVID symptoms. That gives us a sense of what we're seeing in our communities. But looking at those COVID community levels gives us a really good sense of the risk in any given community.
Now, we know that some of our best messengers and role models for getting others who aren't vaccinated to take that shot are people who just got vaccinated because they're living proof that they're doing well and healthy. What do you think people who are already vaccinated can do to help us beat COVID across the country?
Well, it's the key. We know that as we've mentioned already, 219 million people have been vaccinated, but there's different levels of vaccine effect, different levels of how vaccinated people are, I should say. The primary series, those first two shots are so important, but after we got that Delta variant and now Omicron, we've seen that boosters are really critical in keeping people safe. And so we still have some room to go in terms of boosters. So while, we've got over 90%, about 90% of seniors who are already vaccinated, we've got to get those same levels around boosters to really get that protection that's going to save those lives. And you do that by having those conversations with your grandparent, your parent, your aunt, your uncle, your neighbor, your coworker, your friend. Those are the kinds of conversations that get people to think about it. And then kind of apropos to today's conversation, encouraging those folks to talk to their healthcare providers because they'll hear the same message. The data is very clear. If you've been vaccinated and boosted, you are very well protected against the variants that we're currently seeing against COVID-19. And that's critical. We have the tools to save lives with this pandemic. We want to make sure that everybody has those. And what's been great is that we've seen faith leaders in communities. We've seen the public health experts. We've seen teachers. We've seen barbershop owners. We've seen, stylists all going out and being those voices in their community, just giving folks that nudge. And that nudge from one person to another is absolutely the difference. And those kind of nudges have saved a lot of lives.
I'm going to try to squeeze in about 2 more questions. So give me your quick prescription to try to help us reach that population that still isn't quite where it should be. Children, teens, young adults. What's your prescription there?
they've got to really understand why being vaccinated is so important. The first thing is the vaccines are safe and they're effective. So they should feel comfortable with that, but also they're a part of a broader whole. Keeping their parents, their family members, their community members safe is going to be the key. Also, it's allowing them to continue to do the things they love to do, to be teens, to be out in community. That is somewhat predicated on how safe the community is, how many people we're keeping out of hospitals. So I think that getting vaccinated is a key part of moving forward with the life that they want to be having every single day.
Okay, so now let's focus on another group. And this group often is hit by all the misinformation, the misconceptions that are out there about these vaccines, whether they're safe or effective. This is really having an impact on pregnant people, those hoping to become pregnant, and those who are breastfeeding. How do we drive a message to them? What's the truth? What's not? What do you tell parent-to-be, parent who is now nursing a child? What do you do to try to get them to be convinced that the best thing they can do is get vaccinated?
Well, I've got a 6-year-old and a 10-year-old myself. I know that parental instinct to protect your little one starts early, starts before they even arrive and are born. And what's interesting about it is the data is very clear. Vaccines are safe in pregnancy. COVID is not. Getting COVID during pregnancy can be very harmful to that child. And I've admitted more pregnant people to my hospital with COVID-19 than for any other reason in the 10 years I've been practicing. So I think it's really important people recognize what the real threat is and also recognize how valuable vaccination is. The data, and we get more and more every day, really clear, really compelling. These vaccines are not just helpful in keeping you safe and keeping that baby safe, but also afford some protection in those first couple of weeks and months while they're developing their immune system. So there's great data out there. I encourage people, go to cdc.gov/COVID. You can actually go on that page to the vaccines link, look at specific populations, and there's information for people who are pregnant, who are breastfeeding, who are expecting, and it gives them great insight into why we believe so strongly these vaccines are safe. Every medical society that takes care of pregnant people is recommending that these vaccines are a part of your prenatal plan. So make sure you take a look at that.
Dr. Webb, thanks for all that information. We can revel in the work that's been done, but we know we still have much more to do. We're fortunate that so many of those trusted messengers that you spoke about and I spoke about are going to be featured in today's summit. They will be conveying those messages, and we hope that we can get them to double down as they reach out to young people, young adults, pregnant people as well. And we want to say thank you to them. So to the American Medical Association, the American Academy of Pediatrics, the American Nurses Association, the American Academy of Family Physicians, and so many more of you who were part of today's summit. Thank you for what you're doing. I think we're going to move next to a public education campaign video. So we thank you all for participating.
We are America's doctors.
America's pediatricians.
We are America's nurses.
America's family physicians.
And some of us
Our grandparents, too. 8 and 6.
And we want you to know.
COVID vaccines are the right thing to do for our kids.
We've looked at a lot of data.
A lot of cases, but we've learned a lot.
And this is what we're seeing.
COVID vaccines are safe and effective for kids.
My grandkids are vaccinated.
Mine are, too.
Because like you, there's nothing more important to me than keeping our kids safe.
What's not safe
Is getting COVID.
It's getting COVID.
I am seeing children almost daily that have the coronavirus.
Why take that chance?
This is not something to toy with.
We took an oath to do what's best for our patients,
So we want you to know we trust the COVID vaccine.
for ourselves,
For our patients,
for our kids.
So should you.
Okay, great. I hope you enjoyed that video. We are very excited to have the heads of these major medical groups participate in both the ad and in the summit with us today. Next, it is my pleasure to introduce our first panel conversation for the day. Don't let COVID get in the way, getting children 5 to 11 vaccinated. This panel will feature pediatric doctors, community leaders, and leaders from school-based settings who will discuss the importance of vaccinating children and address questions and myths we often hear. To lead this conversation, we are very honored to have Dr. Sean O'Leary, a Denver-based pediatrician and the vice chair of the American Academy of Pediatrics Committee on Infectious Diseases. Dr. O'Leary is also a professor of pediatrics at the University of Colorado School of Medicine and Children's Hospital, Colorado, a pediatric infectious disease specialist, an investigator at ACORDS, Adult and Child Consortium for Outcomes Research and Delivery Science, and the director of Colorado Children's Outcomes Network, Colorado's pediatric practice-based research network. Dr. O'Leary is a member of AAP's Council on School Health, serves as the liaison to CDC's Advisory Committee on Immunization Practices, or ACIP, for the Pediatric and Infectious Disease Society, and currently represents the AAP on ACIP's COVID-19 Vaccine Working Group. Prior to his infectious disease fellowship, Dr. O'Leary was a partner in the large general pediatric practice in Fort Collins, Colorado for 8 years. Dr. O'Leary, thank you so much for joining us. Over to you.
Thanks so much for that introduction. After Dr. Webb's explanations, I'm not sure we need to talk. Those were great, but I think we will dig a little bit deeper. So thank you so much for having me today for this really important conversation. So as I was introduced, my name is Sean O'Leary. I'm a pediatrician and pediatric infectious disease specialist here in Colorado at the University of Colorado and Children's Hospital, Colorado. And I am the vice chair for the American Academy of Pediatrics Committee on Infectious Diseases. So our academy represents more than 67,000 pediatricians. And we, of course, have been very closely following the development of COVID-19 vaccines for children. I'm honored to be here to moderate a panel today with Dan Domenech, the executive director of the School Superintendents Association, Dr. Deborah D'Souza Vazirani, a public health specialist at the National Association of School Nurses, Dr. Andrea Klein-Tilford, president of the National Association of Pediatric Nurse Practitioners, also known as NAPNAP, and Hector Sanchez-Barba, executive director and CEO of Mi Familia Vota. All of us on this panel have witnessed the pandemic's toll on children and teens, whether it's in our hospitals, our clinics, schools, or our community groups. And speaking for pediatricians, I can say my colleagues in all parts of the country have seen firsthand the impact of COVID-19 on our young patients. We know that children can get sick from COVID and some get very sick. Since the start of the pandemic, we've had almost 13 million children who've tested positive for COVID-19, and unfortunately, hundreds of children have died from this virus, with many thousands hospitalized, not to mention, of course, the serious consequences we all know about that the pandemic has had on children's mental health and well-being. The good news, of course, is that we have a tool that we know works to protect them. For children and teens who are eligible, it's so important that they can benefit from the protection that COVID-19 vaccination will give them. The AAP strongly encourages all children and adults to get vaccinated against COVID-19 as soon as they're eligible. You know, while it may feel like we're entering a new phase of this pandemic, I can't overemphasize the importance of ensuring eligible children are vaccinated against this virus. As we've learned, this virus is very unpredictable. We don't know what's coming next. What we do know, though, is that being vaccinated is the best way to protect ourselves, our families, and our communities. I truly wish I could say that this pandemic was coming to a close, but unfortunately now is not the time to let our guards down. In my own career, I've seen the profound impact vaccines have on the health of children. As a medical student and pediatric resident, hospitalizations for diseases like rotavirus and bacterial meningitis were common. After introduction of vaccines against these diseases were introduced widely, encountering these diseases is now pretty rare. We've also seen in real time in the last several months the impact of COVID-19 vaccines, with literally millions of lives saved in the US alone. Since the COVID-19 vaccine was recommended for everyone age 5 and up, millions of children and teens have been vaccinated. The vaccine is safe and effective and went through a long-standing, rigorous, and transparent process before being authorized. If your child does get infected, the vaccine will keep them from getting very sick. My own personal experience of taking care of children sick with COVID-19 in the hospital is that the vast majority in the last several months since children have been eligible for vaccination are completely unvaccinated against COVID-19. And almost all children who end up in the ICU are completely unvaccinated. This is both tragic and encouraging. Tragic because at this point in the pandemic, those hospitalizations were almost completely preventable, and encouraging because we have such a powerful tool going forward to prevent children from suffering. Like many other routine vaccines, the side effects from the COVID vaccine are typically mild and go away pretty quickly after vaccination. And most importantly, they're much less severe than the effects of COVID on children. What's also true is that vaccinating is at the core of the work that pediatricians do every day. We've always been there to answer parents' questions, address concerns, help guide families. Our work now is no different. Like today's panelists, pediatricians have been working day in and day out to encourage families to vaccinate their children against COVID-19. We understand parents may have questions, and we're here to answer them. It's so critical that families can rely on trusted voices in their own communities to have these conversations. Addressing parents' vaccine questions is by no means a new challenge, but right now it's more important than ever that we put in the effort to assure families we're here for them. The COVID-19 vaccine is the most powerful tool in our toolbox to protect children, families, and communities. We also understand that families of our youngest children are still waiting to benefit from a vaccine that offers them the protection they need. And the Academy is eagerly waiting to see the data for the under 5 age group, and hopefully we'll have a safe, effective vaccine for these children very soon. It's important that all children can be protected and families can have peace of mind. So thanks again to everyone for joining today's discussion, and I'm really looking forward to a really good discussion. So let's go ahead and dive right in, and we're going to do this in sort of a moderated Q&A fashion. So my first question is for Andrea Klein-Tilford with NAPNAP. Tell me, what is your experience? What would you tell a hesitant parent about the safety and effectiveness of the vaccine?
Yes. Thank you, Dr. O'Leary. So first, I am humbled and honored to be a part of this conversation today on such a critical topic to the health and well-being of our nation's children. I'd like to thank the Department of Health and Human Services and the White House for the invitation. So certainly safety is definitely a consideration for families when thinking about the vaccine, and rightly so. This vaccine is very safe. We know this based on the emergency use authorization data reviewed by the FDA and the CDC experts and advisors. Safety data continues to be collected through vSafe, VAERS, hospitalization rates, independent researchers, and more from the millions of doses that have been delivered so far. The ongoing safety monitoring is very reassuring for both healthcare professionals and families. In fact, I believe in its safety so much that I had my 2 children, 9 and 11 years of age, vaccinated last fall. One concern that I've heard from both parents and caregivers about the vaccine is about myocarditis. And myocarditis associated with the vaccine is exceedingly rare. However, risk of getting myocarditis associated with acute COVID-19 infection or COVID-associated multisystem inflammatory syndrome is many folds higher than the risk associated with the COVID-19 vaccine. And in rare cases of myocarditis associated with the vaccine, the course is typically mild, which differs significantly with myocarditis associated with COVID infection or MIS-C, which is much more likely to result in intensive care unit admission and life-sustaining therapies. So really, to protect kids from COVID-19 myocarditis, vaccination is the way to go. In terms of efficacy, this vaccine is very successful in preventing serious illness, hospitalization, and death. And that is a victory. We are still learning about the duration of vaccine protection and the frequency of boosters needed, but we will look back on this for years to come as one of the scientific wonders of our time. From identification of the virus to vaccine development and administration, undoubtedly saving countless lives.
That's fantastic, Andrea. You know, I want to pick up on something you touched on that's so important. You know, you mentioned about safety and how surveillance has been, you know, really thorough with this vaccine. And I think what a lot of parents don't recognize is the extent of the vaccine safety surveillance systems that we have in the U.S. that have been in place for many decades, really monitoring behind the scenes to make sure that our vaccines are really, really safe for our children. They have to be safe because we're giving them to healthy children to prevent disease. And I think that the myocarditis example you brought up is a perfect example of the system working. Within a matter of weeks, we recognized that there was a chance of this potential side effect. Out of millions of children, a few children might get this, and that's a sign of the system working. Just to follow up, a follow-up question for you. What would you tell a family who says, well, my child already was infected, they don't really need to be vaccinated?
Well, after COVID infection, antibody response and protection is variable, it's unpredictable, and it wanes with time. So people who have had COVID and do not get vaccinated after illness are more likely to get COVID again. So as COVID infection results in a range of illness from asymptomatic to mild, that's typically associated with low or fleeting antibodies, to severe infection requiring ICU admission with the production of abundant antibodies, we just don't know which children will get severe disease and end up in the intensive care unit. So additionally, we know that a subset of children do get long COVID disease after infection. And there are now many pediatric long COVID clinics around the country to address pediatric long COVID. And we are continuing to learn more about a nuanced link between COVID disease and the onset of diabetes in children. So vaccinating a child after having COVID provides ongoing protection for the child, and it also protects those around them from infection, particularly those at high risk for severe illness, such as grandparents or pregnant teachers, or perhaps their friends or classmates that have underlying health conditions. So for our family, after eagerly awaiting months for emergency use authorization for 5 to 11-year-olds, our 9-year-old son was diagnosed with COVID on the same day he was scheduled to receive his first dose of the vaccine. We were pretty devastated. Fortunately, his course was mild, but we remained anxious to get him vaccinated. So we followed the CDC recommendations and got him in for his vaccine 12 days after he was diagnosed with COVID. So ultimately, there is no reason to delay vaccination after recovering from acute illness, but there are many reasons to proceed with vaccination after COVID infection.
That's great. Thank you so much. I was taking notes because I want to, some of the points you made were really outstanding. So I want to move next to Deborah with National Association of School Nurses. And I should mention, you all are my heroes. These are some of my favorite organizations: school nurses, nurse practitioners, school superintendents. Mi familia vota. This is such an honor to be talking with all of you today. So for you, Deborah, what messaging do you see as most helpful in helping make parents comfortable with the decision to vaccinate their children?
Thank you, Dr. O'Leary. And first and foremost, thank you to the White House and the Department of Health and Human Services. NASN is honored to be part of this conversation. Regarding messaging, the importance of fact-based messaging that is culturally relevant and linguistically appropriate is key to helping guide parents and caregivers to vaccinate their children. The culture, the beliefs, and attitudes of parents and caregivers need to be taken into account when crafting messages about the pediatric COVID-19 vaccine and why children need to be vaccinated. Equally important for parents and caregivers is to have that one-on-one conversation with a trusted messenger. I mean, research is showing time and time again that the one-on-one trusted messenger strategy works and is crucial to getting children vaccinated. And this is where school nurses play a very important role. School nurses are the bridge between health and education. They provide accurate information. They help dispel myths about the vaccine. They're a trusted source of health information in schools, providing evidence of the impact of vaccination on school attendance. As we've seen in the past 24 months, school nurses have played a vital role in helping school districts navigate this pandemic. School nurses are deeply connected to their school communities. They listen to parents and the caregivers about the concerns that parents and caregivers have related to vaccines, and school nurses understand the messaging that is needed to address these concerns.
That's fantastic. Yeah, I mean, I just want to add, nurses in general and school nurses in particular are some of our most trusted members in society, more even than physicians. And I think that's nurses play such an important role. Parents really look to nurses to tell them what is the right answer, what's the truth here. And school nurses play such a crucial role as we're trying to get our population vaccinated. I want to move now to Daniel. Let's get into a little bit more deeply into schools here. So what has vaccination meant for your ability to operate schools safely and keep them open? And tell me about how that's positively impacting education.
Thank you, Dr. O'Leary. And first of all, let me say that everything that we've been able to do it because of our healthcare workers. And thank you all so much for the great work that you have done that has allowed us to get our kids in school safely. For educators, vaccine is part of the process. Ordinarily, you are not admitted into a school or a classroom unless you've been fully vaccinated. So when the vaccines became available, superintendents and educators were eager for those vaccines to be available for school-aged children. So you saw school districts around the country quickly activate to ensure that our high school students first, middle school and high school students were being vaccinated, and then subsequently about a year later for elementary students. But that means everything. You can't have children in school, in person, in a safe environment if they have not been vaccinated. And so that has been part of the process. And as Deborah mentioned before, one of the things that we are dependent upon are these trusted advisors. They're the doctor, the family doctor, all of these people that when parents question whether their child should be vaccinated or not, I can assure them that absolutely it's important that their children be vaccinated. So today we have a very high rate of vaccination, primarily in terms of our secondary, middle school, and high school students. Not as high, but we're getting there with our elementary youngsters. But clearly, as we see variant after variant come along, we're not going to be able to succeed. We're not going to be able to keep those children in school if they have not been vaccinated, because that's what assures you. When we look at the statistics, what we see around the country is that the schools that have been able to be open for a significant length of time are the schools that have the highest vaccination records. And conversely, the schools that don't are the ones that have to shut down all the time. So we're very much looking forward, as we're getting near the end of the school year, that when we start the following school year, that we will be approaching that 100% vaccination that will ensure that our kids are in school and safe and learning. Because, by the way, as much as we love remote learning, the kids need to be in school. They need to be with that teacher, person to person, not only for what they learn, but for the social and emotional support that they need.
Yeah, we here in I'm in Colorado, and my own kids are in high school and middle school, and it was such a relief. They had gone back to school before vaccines were available, and that was great. I think when we look back on this pandemic, the heroic work that school districts and teachers and principals and superintendents did throughout this pandemic is going to be looked back on as just such amazing work. And it was such a relief once we got the vaccines that, there was another added layer of mitigation measures that just made you feel so much better about your kids being safe in school. So now moving on to Hector, let's talk about this is something near and dear to my heart in terms of my own work, trying to promote vaccination within my own communities. We really try to work with a lot of community partners. So I would love to hear your perspective on, what role do community partners play in helping their communities get vaccinated?
Thank you, Doctor. And I want to start by thanking all the infrastructures, organizations, and spaces and professions represented in this conversation and in this summit. Our nation, and actually everybody, should be extremely thankful to all these amazing people being in the front lines, literally protecting all of us and responding to this horrible crisis. Also, thank you to the White House, HHS, and Secretary Becerra for the response on the issue of COVID. For us, this has been a top priority. We are a national organization that is working in 7 states with direct services. On civic participation, we have the largest field infrastructure in the Latino community. So for us, it was very important to respond to this priority because we're a trusted organization. We're an organization that is in the supermarkets, in the tortillerias, in the panaderias. We are knocking on doors all year round. We're helping people become citizens, become registered to vote, doing voter education, etc. So we immediately use our infrastructure to make sure that our community was informed and was getting the best and most reliable information related to COVID. The Latino and the immigrant community were the most affected on the issue of COVID because we are overrepresented in professions that are in the front lines. Majority of farm workers are immigrants, majority of people working in restaurants, in the food industry, in construction, etc. So we were seriously affected by this horrible disease. So it was important that the community gets the best and most reliable information. So that's what the role of Mi Familia Vota came in place to make sure that that trust is also communicated to the community. What we did, we immediately tried to be as creative as possible. how do we provide this information? How do we provide what the community needed, especially at a time when we are suffering from the highest levels of misinformation? What has been happening in the nation and in some of our communities is unacceptable. And that was happening also in the terms of COVID and vaccination. So immediately start using all of our networks, all of our contacts, all of our creativity to make sure that we were not only fighting that misinformation, but that we were providing the best and most reliable information. For example, we created one of the only hotlines in bilingual, in English and in Spanish, 24 hours, fully staffed, to make sure that we were answering or directing people to spaces like all of yours, the real professionals, the real experts that have the most important research, that have the most important and most reliable information. So that's what we did immediately. We partnered with infrastructures in Spanish like Univision and other networks, Entravisión, Telemundo, to make sure that we were providing in those networks, in radio, in ads, all of this information. We also had a teletown halls in over the phone, because sometimes the older population still uses the phone, and it was a success. Thousands of people joining us on these conversations over the phone in Spanish with some of the celebrities, with trusted spaces and people, providing the best information and trying to respond to all of these needs. We did clinics in partnership with infrastructures and different spaces. But that's a little bit of the context. Bring and participate and collaborate with the most important infrastructures. Our way of organizing is through our 8 pillars, which is organizations like yours, churches, schools, community-based organizations, consulates, etc. So that was a little bit of the context of how we've been working with the community.
Incredible work, so important. I mean, literally saving thousands and thousands of lives with those efforts. Incredible work. Now I move back to Deborah. Now, we know a lot of schools have run vaccine clinics, and I know that there are challenges to getting vaccines delivered in schools. How have you seen those be most successful within schools?
First and foremost, the school is the ideal place to reach the over 50 million children who attend school each day. They come from various socioeconomic, cultural backgrounds and age groups. And the school is also conveniently located in a familiar and trusted community environment. So first and foremost, that's key. NESN recently partnered with the Association of Immunization Managers, where we developed a series of evidence-based resources focusing on best practices in planning and executing successful school-located vaccine clinics. And what we found is that school nurses as the leader of the school health services team, are key to implementing a successful school-based vaccine clinic. They can identify students who have missed vaccines. They can identify and secure spaces within schools which have the capacity to hold an SLV or school-located vaccine clinic, such as a gym or a library. They also have experience collaborating with community partners, local healthcare providers, school officials, teachers, and parents. And they can offer a convenient option for parents to have their children receive needed vaccinations when the parent cannot get to a healthcare provider visit or take time off from work. And children miss less instructional time if vaccines are provided on site at schools. So school nurses can, help secure healthcare professionals, nursing school volunteers to participate in these school-based vaccine clinics. Other successful vaccine clinics we have found is when we partner with local public health or other trusted community vaccine vendors, school and community leaders, but also including parents in the planning and implementation of these school-based vaccine clinics, because they become convenient and they also become accessible.
It's great. Yeah, I mean, I think it's so important, because what we're seeing, there's been a lot of talk of not as much uptake in the 5 to 11-year-olds. And I think, people talk about its parents refusing vaccines, and sure, there's some of that, but a lot of it is parents they can't get out of work. They can't take the time off. There are lots and lots of barriers. And so schools can play such an important role to address those barriers. And I want to follow up with Daniel on that. With, what have you seen some districts do that have been, or individual schools that have been particularly successful?
Well, thank God for our school nurses. And we only wish that we had so many more of them. But clearly, what's most successful is when schools are able to offer the clinic in the school so that the children are there. And for example, the U46 school district, which is an elementary school district in Elgin, Illinois, they have 40 elementary schools, and they were able to offer in-school clinics for basically our youngest children. And that had a big significance in terms of being able to get so many children vaccinated, particularly because the parents could give permission, but they didn't have to be there for that to happen. In North Carolina, the Cumberland School District, a large school district in North Carolina, partnered with their local hospitals, and they were able to offer in school at the high school level clinics and get their high school students and middle school students vaccinated. A rather unique approach in East Hartford, Connecticut, that school district offered students that got vaccinated a day off from school. That's pretty popular. That went very well. And even in the Washington, D.C. area, a school district where I had been superintendent some years back, the Fairfax County School District, their superintendent, Scott Brabrand, early on at the beginning of the second year of school, was calling me almost every day asking, when are we going to have a vaccine for our kids? When are we going to have a vaccine for our kids? So subsequently, they were able to get a high percentage of their students vaccinated. So clearly, the opportunity to offer those vaccines in school, within the school, leads to a more successful percentage of students vaccinated.
That's great. Yeah, I don't know that I necessarily want to encourage absenteeism, but if it means that they get the vaccine and they're going to miss less school, I'll take it. And I want to echo what you started with. Thank God for school nurses. If we had a full-time school nurse in every school in the country, we would be in a much better place.
Absolutely.
Hector, I want to move to you because we've touched on this a little bit, but I want you to expand on it a bit. We've seen disparities in vaccination rates across different communities. Tell us a little more. How do we reach out to these underserved populations who have additional barriers to access? I touched on that for a lot of these families. Schools provide one option, but let's talk about some of the others.
Yeah, no, the sad reality is that we have the biggest gap, especially in the most vulnerable communities when it comes to vaccination. We have been able to close the gap drastically, especially through the last year and the drastic changes in policy and implementation of policies. And where we have been able to collaborate with infrastructures like all of us, the White House and Secretary Becerra. It's great to see you, Secretary. I don't know if you're hearing or not in Spanish in all of the communities. But the creativity continues. You say something very important, Doctor, and is how hard it is for hardworking families that have 2 or 3 jobs, which are overrepresented in the immigrant communities and in the Latino communities, in other minorities. And sometimes it's really hard just to make the time. Every hour represents not earning either minimum wage or spending time with your children. How do we continue using our infrastructures, our creativity, languages, cultural competency to make sure that we make it as easy as possible and take it to the places where our communities and our parents are? We spoke about schools, we spoke about churches, we spoke about unions, we spoke about community-based organizations. Secretary Becerra, I think 2 days ago, was in a consulate. The consulates are spaces of trust where immigrants go to get some of the basic services related to countries of origin. So that is one element. The second one is we cannot put our guard down. Right now, we need to continue. COVID is not over. And we don't know how long it's going to take to be over or how this is going to continue changing. So we need to make sure that we continue putting a lot of pressure on all of the infrastructures and that we need to making sure that we keep this as a priority in all of these spaces and in our democracy. Make it as accessible as possible.
Absolutely. We have a few more minutes for a couple more questions. And I want to go back to you, Andrea, just shifting gears a little bit here. Let's talk a little bit about communication. So, we know it's really important to meet parents where they are and for us as healthcare providers to start these conversations. What messages do you have for providers in starting these conversations with families?
Yeah, sure. We talk a little bit about, I think the first part here is that parents and families consider their child's healthcare provider to be their most trusted source of information about vaccines. And this does include the COVID vaccine. This is also true for parents and families who are vaccine hesitant or who have considered delaying vaccines. And therefore, healthcare providers have a critical role in helping parents and families choose vaccines for their children. So when discussing vaccination, words matter. Words matter a lot. And it's often best to use a presumptive approach when talking to families and speaking confidently. Don't waffle or sound ambivalent about recommending vaccines, and share your personal story with your patients and their family. For me, it's I'm vaccinated, my husband is vaccinated, my 2 children are vaccinated, and really giving the family a strong recommendation. This vaccine is important to protect from serious disease. And also be prepared to answer questions around the vaccine, including addressing side effects, which we've talked about a little bit in the 5 to 11-year-old are pretty minimal, fortunately, but also about some of the myths that come with this vaccine as well. And if there's hesitation, listen, find out why they're choosing not to vaccinate. And sometimes it's not the vaccine itself. Sometimes it can be fear of needles or other concerns, which provide an opportunity to help create solutions to overcome these barriers. Also recognize that just because they may decide not to vaccinate on that day, it's not a failure. Keep at it, keep the conversation going at the next visit, and ultimately acknowledging that there's a shared goal. Healthcare providers and families have for children, and that's for every child to grow, develop, thrive, play, and to be safe. So we still have some work to do. The 5 to 11-year-old age group remains less than 30% fully vaccinated. And really one of the greatest things and gains that we can do for the pandemic in our country is getting those that are unvaccinated vaccinated.
Absolutely. Yeah, I think you put it really nicely. I think the facts are important. I think of that as the what. That's what we need to know as healthcare providers. But what's the how? How do you communicate the facts to people so that they resonate and that they're meaningful to them? And so that's hugely important. Last question to Deborah. What do you say to parents who are confused about dosing effectiveness? What are your sources for information where you'll send parents?
So, school nurses have the knowledge, they have the expertise to respond to parents regarding immunization schedules, doses, and timeline between vaccine doses. School nurses are also providing accurate healthcare information in flyers, newsletters, school websites, and parent-attended meetings. And school nurses frequently refer parents to their primary healthcare provider, their pediatrician, their pediatric nurse practitioner, the promotora that they may be working with, the community-based organization where they can get their, vaccination and other information if needed. For our school nurse population, NASN has a COVID-19 reference page, which is front and center on our website. It has links to the CDC and FDA and other updated information for our school nurses to constantly refer to and access when needed.
Fantastic. Well, I think we are running towards the end of our time here. So I just want to thank all of you. Like I said, you all are my heroes. You're doing such important work. And this has been fantastic. Thanks also to the White House and HHS, Dr. Becerra and Dr. Webb for the introductions. And we will pass it back to the moderators.
Thank you.
Thank you.
All right, here we go. Wondering if the COVID vaccine is right for your child?
If you can trust it.
Want to know what a healthcare professional would say?
Well, I represent over 100,000 family doctors,
I represent over 4.3 million registered nurses.
nearly 67,000 pediatricians.
And we all agree on this.
It's important for all children 5 and older to get a COVID vaccine.
Because we know millions of cases of COVID have been in kids.
In kids,
Kids. So I speak for pediatricians.
the nurses you know and trust.
The family doctors you see all the time. We've looked at the data.
We've studied the science.
And it's clear to me.
It's very clear.
You can trust the COVID vaccine for yourself or your kids or your grandkids.
I do.
I do. I do.
I mean it from the heart.
Hey, guys.
As was mentioned, I'm Dr. Ernest Grant, President of the American Nurses Association, and it is a privilege to be here today on behalf of the ANA, which represents the interest of the nation's 4.3 million registered nurses. You know, throughout this pandemic, ANA has continued to act swiftly, providing teaching tools for nurses, bringing patients' needs to the forefront, amplifying nurses' voices, and promoting vaccine efficacy. In fact, our organization has a long history of advocating for vaccines. Since the emergency authorization of the COVID-19 vaccines and subsequent boosters, ANA has prioritized state and national efforts to get all Americans vaccinated, including children 5 and under. As trusted members of their communities, nurses have been instrumental in education efforts and administering COVID-19 vaccines in record time. Collecting data from nurses about their experiences on the front lines has also been a priority for ANA and the American Nurses Foundation. In a recent mental health and wellness survey, 92% of the nurses surveyed reported that they had been vaccinated. And in the foundation's latest surveys, nurses were asked about the vaccine's impact. Within the content of mental health, and receiving the COVID-19 vaccine was found to be a leading activity that strengthens nurses' well-being during this time. Personally, I have shared my own experience as a participant in the Moderna phase 3 clinical trial. I chose to participate in part because I recognized the need for more people of color to participate in the clinical trial, but also as a leader, I wanted to stand in solidarity with my colleagues and alleviate any concerns or hesitancy surrounding vaccines. Vaccination plays a critical role in protection and prevention, and the benefit far outweigh any perceived risk. With such high efficacy rates, the vaccine is extraordinarily effective at protecting you from the virus. By getting vaccinated against COVID-19, we can help prevent an uptick in new infections and hospitalizations, and ultimately help our nation recover. Thank you very much for this opportunity.
Thank you, Dr. Grant, for those inspiring words. I don't think it can be said enough how important our nation's nurses have been in fighting the COVID pandemic, not only treating patients, but getting vaccines in arms for millions of Americans. So once again, thank you for all that you are doing, and thank you to the American Nurses Association. Next, I am very excited to introduce our next panel on pregnancy and nursing moms, addressing misinformation. This conversation will tackle the misinformation around pregnancy, fertility, and breastfeeding head on. We are excited to welcome OBGYN experts, moms, and mom partner organizations to discuss the importance of vaccination for this group. And without further ado, it is my deep pleasure to introduce our moderator, the creator of What to Expect and the founder of the What to Expect project, Heidi Murkoff. Heidi's groundbreaking pregnancy guide, What to Expect When You're Expecting, has sold more than 22 million copies worldwide and has been dubbed the Pregnancy Bible. Heidi has gone on to write several more pregnancy and parenting books, and the What to Expect books collectively have sold more than 42 million copies in 38 countries and have been translated into 44 languages. In addition to her literary success, Heidi's passion and commitment to moms and babies led her to create the What to Expect Project, a nonprofit organization dedicated to helping moms in need have healthy pregnancies, safe deliveries, and healthy babies. The What to Expect project has been expanded its mission globally to reach the most vulnerable moms around the world to help ensure the care, information, and support they need to have healthy pregnancies and safe deliveries. And with that, again, it is my absolute pleasure to turn it over to Heidi Murkoff.
Thank you, Erin, and a big thanks to everyone at HHS and the White House for hosting this really important conversation. And for everyone out there watching, I know you're all here because you care as deeply as all of us do about the health and well-being of moms and babies, because maternal health, and I would say actually reproductive and preconception health, is the foundation of all health and is certainly the foundation of a healthy future. And something that has really, I think, shaken the foundation of maternal health to the core over the last 2 years, both directly and indirectly, is COVID-19. And I think it's safe to say we'd all love to put the pandemic and the stress of the last 2 years, especially for moms and families, kids, behind us, way, way, way behind us. And the very best way to do that is getting everyone who can be vaccinated and boosted. And that goes especially for pregnant and breastfeeding moms, especially pregnant moms who are at a much greater risk for serious complications from a COVID-19 infection. I always like to start with the premise that every mom wants the best for her baby. Every mom wants to keep her little one healthy and safe even before the baby is born. And we have millions of pregnant moms on What to Expect. They are not just a community, they are really a sisterhood, as all moms are. No matter where in the world they live, no matter what their political, religious, racial, cultural, socioeconomic profile, every single one is connected by a universal emotional bond that all moms share. And that's the unconditional love and overwhelming, unwavering concern that they have for their little ones. But the question here today is, how do we as healthcare providers and community leaders and policymakers and aunties and other mother lovers, how do we convince all moms and dads that what's best for them is and their babies is following the science and getting vaccinated when they're pregnant, when they're breastfeeding, even when they're thinking about getting pregnant? That getting vaccinated is safe, effective, and actually protects not only them, but their babies. Listen, every parent out there has questions, lots of questions about COVID-19. And that's what we're here today for. We're here to answer those questions, to clear up the confusion and the misinformation, and sift through vax facts and vax fiction. So all moms can feel good, really, really good about getting vaccinated so they can protect for two, themselves and their babies. So as they say, we can do this. And luckily I have an awesome panel to do this with. I have Dr. Sarah Oberton, returning champion of What to Expect, Associate Professor and Division Director of Maternal Fetal Medicine at the University of South Florida. Hey, Sarah.
Hi, thanks for having me.
I have Dr. Jane Von Dis, Assistant Professor and OBGYN at the University of Rochester Medical Center. Hey, Jane.
Hi, thanks for having me.
It's my pleasure. And Dr. Sian Farouk, Assistant Professor at the Columbia University and an emergency medicine physician at New York Presbyterian. Hey there, Sian.
Hi, Heidi. How are you? Nice to be here.
I'm so happy to meet you guys. And Donna Norton, who is Executive Vice President and Chief Advancement and Strategy Officer of Moms Rising. Hey, Donna.
Hi, thanks so much for having us.
Oh, so I'm going to start with Sarah. And let's begin before the beginning with those who are planning to get pregnant or even just thinking about getting pregnant sometime, anytime in the future. Please tell us once and for all, and louder for the moms in the back and dads in the back, why are you so confident, and why should hopeful moms and dads be so confident that mRNA vaccines do not cause infertility? Take it away, Sarah.
That's right. So it seems like this has just happened, this pandemic, but in fact, we actually have a decent amount of information. And the vaccines have gone through a rigorous process of animal testing, which have all been reassuring. And then there's a lot of human data right now to tell us that this does not affect fertility. mRNA vaccines, these messenger RNA vaccines, cannot enter our DNA and therefore cannot affect things like fertility or defective birth defects and so forth. They don't impact how the ovary or the uterus or the uterine lining works, and they have no ability to do that. So we have a great safety profile now, and we have societies, academic societies like the Society of Reproductive Medicine, Society of Maternal Fetal Medicine, recommending the use of vaccinations prior to pregnancy, and that they do not cause infertility for future families.
And this goes for both women and men. So
that's right.
To the TTC couple.
Exactly. There doesn't get sperm count or anything like that.
Awesome. And Sion, I feel no one is more qualified to speak to a pregnant woman's perspective on pregnancy vaccines than someone who has recently walked the walk and can now authentically talk the talk from personal experience. You know, as anyone, any of us who've been pregnant before knows, we worry about everything that goes into our bodies. We worry about coffee and blue cheese and Tylenol. Yet you decided to get your COVID vaccine when you were expecting your baby girl. Please give her a snuggle from me. And can you tell us how you made that decision and how it impacts the way that you talk to your mom patients?
Thank you for that question. So I've been speaking about this topic from the second I got the vaccine, which was back in December 2020. I worked in New York City during the first wave when COVID was the scariest, and we had many unknowns at the time. Of course, 8 months later, we were able to get the vaccine, and soon after I became pregnant is when the vaccine actually became available. And at the time, there were a lot of unknowns, especially with new variants coming around. And the vaccine felt like, for me, an extra body armor. And I looked at the data. There were, at the time, the emergency authorized vaccine was the Pfizer vaccine. And after looking at the data and discussing with my OBGYN doctor, I felt getting the vaccine was the right decision. And of course, just like you said, I was worried about it. I was not the first person to stand the line. And I took a week to think about it and decide. And now looking back, I know it was the right decision. And having a healthy and thriving baby boy with the reassuring data and the safety profile around the vaccine. I know you talk to many moms, so it's fine. I'm happy to share the story with many of my patients that I see who are worried about receiving the vaccine or the booster while pregnant. And I did get the booster while breastfeeding, and my baby is now thriving and doing well.
That is so awesome. And I think that perspective helps so much because you have your mom and your doctor hats both on. You see, Jane, you see a lot of pregnant women and their partners. Have you personally cared for women who weren't vaccinated, got COVID, and faced complications? What would you tell those moms?
Well, what I would tell those moms is that actually, and I've cared for a lot of them, by the way, what I tell those moms is that the vaccine is safe. The CDC has their vSafe website, and they've collected over 200,000 pregnant moms' experience of the vaccine in pregnancy, like our last speaker, and what they found is that there are no complications that are additional. Yes, you might experience a little bit of pain at the injection site, and yes, you might even have a little fever afterwards, but nothing that would affect your pregnancy, and that's really, really important. Now, here in April of 2022, we have huge data sets, right? We have data from 44,000 women showing that there was no increased pregnancy complications. And with COVID, we know that women are at increased risk, not only of complications from infection, but 22 times more likely to die from a COVID infection, more likely to be admitted to the ICU, more likely to be hospitalized, more likely to be placed on a ventilator. So we have the extremes. On the one hand, no risks to pregnancy with the COVID vaccine, and lots of risks if you get COVID while pregnant. So luckily, the data has been very, very clear, and it's data from around the world, not only US data, but it's basically, I tell my patients that not only is the vaccine safe for mom, but it's safe for baby. Yes. Moms can get vaccinated in the first trimester, and they still show antibodies after birth, and their newborns show antibodies. The point in time that moms get the maximum amount of antibodies is when they're vaccinated early in the third trimester. But I tell moms the best time to get vaccinated is right away. If you haven't been vaccinated, the best time is right now.
Right. Even if you're about to, go into labor, like just get it, just get that vaccine. No, that's so important. Why do you think, and anyone can answer this, why do you think we're kind of stuck at a certain percentage, and it's really hard to tell what that percentage is now because, some moms got vaccinated before they were pregnant. But in terms of convincing moms that they should get vaccinated, how can we get them off the fence, get them to roll up their sleeves?
I think there's a lot of misinformation right out there. It's easier to get some of these inflammatory misinformation when it comes to scientific literature. And that's really hard. And I think the best way is to have this great patient-doctor relationship with your physician and with your community and trying to get that best information. We can't minimize people's concerns and fears, but we can fight that by the information that we have. And I think why these things are so important and why doing studies on pregnant patients is so important. We do a disservice by not including those patients in studies, and why we are fighting for Society of Maternal Fetal Medicine and Mother to Baby is to be able to include any patients that are pregnant in studies, because it's so much, it's information that we need as a society.
And speaking of that, Donna, Moms Rising has done so much great work, and thank you so much for that, to activate moms across the country to share the facts, to counteract the vaccine misinformation and disinformation. I'm not really sure what the difference is, but they're both bad. We have to combat them both. I'm pretty sure you agree that finger wagging, preaching, lecturing, none of those are the best ways to do that. And that it's more about mom to mom empathy that alleviates fears, but also, nobody gets a mom like another mom, right? So if we can start with that mindset, what is your best strategy?
Well, first, I think we have to just start with the recognition that moms have been through this really terrible, really difficult period. And, people are doing their best to protect themselves, their infants and children, their elderly family members, in a really difficult information environment where there's a ton of misinformation being spread, especially on parenting sites and mom blogs. And it's really hard to, parse out what's true and what's not. So we've really tried to, start where moms are and help them disentangle, what's true and what's not. And we talk about credible sources and, where to look for good information. We always say, talk to your doctor, and you guys have all provided amazing information, and doctors are such trusted messengers for moms. So I think that's really important. And also we've been lifting up the stories of moms who have been vaccinated and have had good experiences and good outcomes, and just talking mom to mom about your experiences, I think is super helpful and important.
Absolutely.
And Heidi, can I just add something there?
Yeah, absolutely.
One of the things that I think is sometimes helpful for moms is to talk about the benefits to their unborn child, to the baby. And I love Dr. Waldorf's site. It's called One Vax, Two Lives. So One VAX TWO Lives. And she's actually out of the University of Washington, and hers was some of the first data that we had in January of 2021, so a long time ago, showing the deleterious effects of COVID infection on moms. So sometimes what I might do is kind of talk about what the increased risk of stillbirth and preterm birth are for unvaccinated mothers, and use, if you don't want to do this for yourself, do this for the benefit of the baby.
Absolutely. As I say, protect for two, baby and you, but
right.
That's just me. And then, I wonder if any of you think that the fact that hospitalizations are currently down, cases are going back up, but the fact that fewer people are getting super sick at this moment, does that mean that the fear of getting COVID is waning, and that might make vaccination in and of itself a tougher sell for pregnant moms and breastfeeding moms, and actually anybody?
We do get an uptick of patients wanting vaccinations when we're in the middle of a worsening time period, right? But if something like this happens to you, like Jane said, you do have a higher risk of preterm birth and stillbirth. So it doesn't have to happen everywhere in the community, but if it can happen to you, then that can hurt your family unit. And so I think it's important to keep it on the front of that and understand that these things wax and wane. And thankfully, we're now on the downtrend of that, but it doesn't mean that that should affect some of your decisions about getting the vaccination in pregnancy.
And also because you have to take all that time to get your series. So to be fully protected, you need some time. You can't just say, okay, I'm ready now. There's a surge, I'm ready to get vaccinated, because it takes a couple of weeks at least for those antibodies to kick in, right? So right. That's kind of part of the equation. And speaking of antibodies, I would love for you guys to talk, Jane, you already brought this up, but just in terms of what kinds of protections that babies get. If you said you get some and you get most in the third trimester, you get some in the first trimester. If you've been vaccinated before pregnancy, would you still have enough to give baby a cushion, even if you've had your third shot, your booster, and you're coming into pregnancy? What would you say?
Yeah, I do think boosters are a really great idea. I think getting vaccinations prior to pregnancy is fantastic. And if you're 5 months later, you can be eligible for a booster. And that should be what's happening. Again, for the same reasons we talked about and how pregnancy is a higher risk state. And getting a booster, it would almost like be ideal, right? You're protected before your pregnancy. And then you get a booster, then like Jane said, you have additional protection for your baby. There's two ways we protect our children, is that we cocoon them by the fact that all of us are pregnant. And so we protect them that way. And then there's this potential of giving antibodies. So even though the vaccine doesn't cross the placental barrier, the antibodies do and help that unborn baby. Because we do see these antibodies in cord blood. And we do see it actually in breast milk. So there's this potential of this additional effect of these antibodies being helpful even outside of that cocooning effect, which I think is really important.
By the way, I love the word cocoon. I use it all the time. Just, when it's too soon to get babies their vaccines in the first 6 months, and beyond, it's so important that we all cocoon, everyone around a baby is vaccinated. So this is also for grandparents, for fathers, for care providers, everybody. And we're not just talking, we're also talking, flu season is coming to a close, but in just always getting your flu shot, always getting, and with every pregnancy. Tdap. I was just going to say that. So yeah, super, super, super important. And that's really one of the best ways to cocoon your babies.
I wanted to add also something just to what Sarah said. There's a lot of misconception that if you've already been infected, especially with Omicron, there were so many infections that you have antibodies. When we're on the topic of the antibody discussion, that it comes up a lot, not just when we're among pregnant, but especially among pregnant women. Oh, I already got the Omicron and I have the antibody from that. So I think that misconception that antibodies from natural infections are everlasting and that you will need the vaccine because you've already been infected. And I actually seen it with my own decision because I was infected very early on. And when I decided to get the vaccine, was actually, unfortunately, personal attacks from anti-vaxxers, calling me all sorts of names. Why would you even get that? You're trying to kill your baby, hurt your baby. But I think because this kind of messaging is around from the community, from different influencers, unfortunately, a lot of people feel like they're hurting the baby by getting the vaccine, and they say, I've already been naturally, I already have the antibodies from the infection. So there's a misconception that you don't need the vaccine from natural infection. So that is a big misconception that I have to discuss with my patients every time they come to the hospital.
Absolutely.
And actually, Heidi, we have data behind that. There was a study performed on newborns at 6 months, and it found that 57% of newborns of vaccinated moms had antibodies at 6 months, where only 8% of newborns born to mothers who had the infection but no vaccination had antibodies. So a marked difference in the number of antibodies expressed in that newborn at 6 months.
That's another whole layer of protection. And now I guess if you've had, Sian, you've had the infection and you've had your whole series of vaccines, so that probably gives you small additional protection.
Yeah, I mean, that's what we would presume. But again, that does not stop me from getting boosted when I'm eligible. The scary thing is, of course, with new variants, right? Unfortunately, we don't know what's coming. And we've seen it with the Omicron, especially even people that were infected from the first variant, the Alpha variant, they were infected. When you see with the people who were vaccinated, they were more protected. So we have to, and I love how Jane is like throwing the data at us. I think numbers, I love numbers, just being a nerd as a researcher too. So this is what we have to wait for. And instead of just looking at, just some of the details, but when we have a large scale and the studies coming from moms and from children, I think that's more reassuring to what we're doing.
Absolutely. Well, I mean, I've had my second booster, but that just tells you how old I am. So let's not even go there. But we're all anxiously awaiting for the under fives to get vaccinated. So in the meantime, we all have to do our part. But hopefully we'll get like a bulletin later on in the summit. Maybe. Who knows? A girl can dream.
That would be amazing.
Yeah. Wouldn't that be great? I thought that was going to happen a while back. But okay. I have a 9-year-old fully vaccinated grandson, and then I have a 3.5-year-old. So yeah, it's like you do what you can do. Sian, I wanted to ask about Black maternal health. We just celebrated Black Maternal Health Week, and really there's very, very little to celebrate. We do a particularly terrible job in the US, first of all, taking care of moms and babies in general, but also specifically taking care of Black moms and Black babies. Can you speak to some of the disparities in healthcare and outcomes faced by Black moms, also American Indian, Alaska Native moms, and, increasingly over the last 2 years, there's been an uptick in maternal death for Latina moms. So, why are these moms less likely to be vaccinated? How can we get them vaccinated? Can you just tell us a little bit about why we have this problem in general?
Yeah. So before the pandemic, right, there's already an alarming racial difference in maternal mortality, especially with being Black women over 3 times more likely to die in pregnancy, postpartum than white women. And looking at, of course, it's very dependent on where you are in the state and the resources that are available to you. But people of color, women of color, are 2 to 6 times more likely to die from complications of pregnancy than white women. And the zip code actually defines whether you'll be able to survive pregnancy or not. That's unfortunate. And I find this number egregious as someone who works in global health and being from Ethiopia or sub-Saharan Africa, where we see this maternal death. But you see this in a high-income country. It's unacceptable to live with this outcomes and these disparities in a country that's resourceful. And of course, this pandemic has worsened the gap in the outcomes that Sarah mentioned earlier. Pregnant women are a higher increase of dying from COVID and being hospitalized, and add that to the equation of having the disproportionate and the vaccine uptake being lower in this vulnerable population, especially in Black and Brown population. So that adds to the gap that already exists. And also, I think I say all this all the time, we've failed people of color during this pandemic. And before the pandemic, we failed Black women. We failed Black moms, and continued during the pandemic. And after the pandemic, it will continue to do so. And a lot of the discussion and the mistrust that I see around the vaccine is because of misinformation, unfortunately. And when I see patients in the emergency department, I work in Washington Heights, where I treat many Hispanic, Latino patients and Black patients, most of the decision is based on what's available to them. They don't have access to their primary care. There's a long wait for OBGYN doctors. They use the emergency department as the source of their primary health care. So I've had opportunity to discuss and to find ways how we can get them vaccinated, but it's really they rather get the information from the community or people who they trust. I've tried my best and my share and share my own story, and usually the answer that I get is nobody has discussed that with me. I feel much better after discussing that with you. And it's also a big factor when you hear it from people that look like you. So there's a lot of misconception, and of course the historical, unfortunately, what we've seen here with the Tuskegee studies, there's a lack of trust in the medical community in general, and it will take us a long time to close that gap. And unfortunately, COVID has worsened it. There's a lot of work to be done, Heidi.
It totally has. And I think, we were all worried, well, will COVID impact pregnant women, directly? There's indirect impacts that we have seen. And I knew they were coming because right after Ebola, we went to Sierra Leone and saw how maternal health had been decimated by, as in any, healthcare crisis or any crisis of any kind, maternal health seems to get put on the back burner. And we saw this during COVID in terms of, clinics closing, women not having access to their providers. I was fielding on Instagram messages from moms who were saying, I can't find any place. My clinic is closed. So then how are you supposed to get your routine vaccines? How are you supposed to get your routine testing? How are you supposed to be able to ask the questions that you have? To me, that's a huge failing. And it's true of Black moms, also rural moms, whether they're Black or white or Latino, Indigenous, it really doesn't matter. They're not getting that source of trusted information. Does anyone else want to share? Donna, you want to share anything from your moms?
Yeah, no, I think getting information and even fear of going to the doctor during COVID and getting infected in the doctor's office and those kinds of barriers, I think, also let a lot of misinformation spread. And so this is a time where I think we can clear up a lot of information. And Jane, the information that you shared about how getting vaccinated when you're pregnant actually protects your baby, I think is hugely important and motivational for moms. There was a recent study from Kaiser on the percentage of parents who were excited to get their children vaccinated. It was just like a third, and a third were against it, and a third were kind of wait and see. We have a lot of work to do, but I think this is a great time to do it.
Yeah, we absolutely do. Jane, were you going to say something as well?
Oh, I was just going to say, you guys know that I'm massively enthusiastic about telehealth, and
yes.
That was a way that we were trying to connect with our patients as well. I worked at Maven for many years and really met with so many moms virtually answering those questions, either on an Instagram Live like you, Heidi, or in one-on-one visits. So I really hope that we continue to put parity into telehealth in terms of reimbursement and drop down those regulations, because that is a way that our rural moms can access care that might be hard in the current brick and mortar situation.
Absolutely. And I think there's also a place for, definitely for doulas, but also for training community workers wherever a mom lives, so that they have, it's kind of like, so in Africa, there are traditional birth attendants who have to be, brought up to speed on how disease is transmitted, because they, instead of being the problem, then they can be part of the solution. And the same thing goes in communities all over the US. You have to have that sisterhood around you, but a well-informed sisterhood. That's kind of the critical part. Sarah, I know we kind of covered this, but breastfeeding is something that moms ask about all the time on What to Expect. We've talked about it on What to Expect many times. And we know it's safe to breastfeed, to get a COVID vaccine when you're breastfeeding. And I think there was a lot of hesitation at first based on the fact that some organizations were saying you shouldn't breastfeed your baby when you have COVID, that kind of thing. And we've learned so much. Do you want to give us like a little summary of what we've learned?
Yeah, for sure. So we did get a lot of misinformation. In fact, I was going to mention earlier how it's so important to also teach the healthcare providers, right? Us teach the physicians, teach the of why we're doing things and keeping on top of the new data. So the studies that are out now in terms of lactation and the antibodies that are available in the breast milk, we know that there is some. The question is, what do they do? And we are hopeful that these antibodies provide an additional protection to your new baby, but because we know they're present. There's still some studies that need to be done to know exactly how much and to know exactly when in relation to when your last dose was, how protected that is. But it is in support of actually giving the vaccine during lactation or just before delivery. One shouldn't be afraid of that. The vaccine does not, by its bioavailability, doesn't actually get into breast milk, but the antibodies do, and that's the key. You want those antibodies. The idea is your body creates the antibodies to help not only you, but through then the placental passage, through blood, through the breast milk, it helps your little one as well.
And so breast milk is already chock full of antibodies, regardless, but not specific to COVID unless you've had this vaccine.
Right. In fact, there are more antibodies when you get the vaccine than when you've actually had the disease. You get more antibodies just by the vaccination. So even if you had COVID, still get the vaccine, it's going to be helpful.
And a lot of moms have been, extending breastfeeding, which is great. But do you think that, breastfeeding for 2 years is going to continue providing those antibodies? Or we just don't know yet?
We don't know yet how long that will last. Certainly breastfeeding is, as when we deliver, is more important closer to delivery, and how long that benefit extends is not yet known for the antibodies.
But we got benefit, that we know. So Donna, when you talk to moms about the vaccine, what are some of the things that surprise them most about the data?
Well, moms are super busy. Most moms are working all day and then taking care of kids when they get home from work, and really like no ability to keep on top of like the incredible science and studies and research that's been happening around the COVID vaccine. So I think people are surprised at how much is known now. There was a period in which less was known. Now there's like been giant studies about the impact of the vaccine, and there's a lot of really great news. So I think it's surprising for some moms how unambiguous the benefit of getting the vaccine is for you. To get it during pregnancy is a great thing. It's a great thing for your baby, for you to get it. There's like a lot of great data now that I think still needs to get out to moms, and you guys are doing a great job of getting that information out there.
Yeah, and we have to, should I say mainstream or mom stream it? Like
mom stream it.
Make it more accessible. Right.
Right.
So, I do have another question that I would just love to get all your opinions on. And it's we've kind of touched on this, but do you feel, I think we've already seen the trickle down of COVID vaccine disinformation and misinformation on routine childhood and maternal vaccines, so that there's suddenly even greater reluctance, or much more reluctance, to get any kind of vaccine because, vaccine equals something we don't want to do. And so I almost feel like we have to renormalize vaccines, make what was routine again. But do you guys worry about this? Like, does it keep you up at night? Like it's been keeping me up for the last 2 years. Like, what can we do to make sure there are no future outbreaks of vaccine preventable diseases? All the ones we thought we got a handle on, but here comes measles again. God forbid, here comes polio. Let's not go there. What about pertussis, whooping cough? Are we going to have outbreaks because moms won't get their Tdap during pregnancy? So just let's figure out a way to combat this.
Well, I actually think, Heidi and Donna can be really helpful here, because what I notice is that since I'm trained as a physician, I don't always have the skills of scientific communication that are necessary to convey information in a way that's not only perceptible and ascertainable, but actionable. And one thing that I've noticed over the last 2 years is that just saying the science oftentimes isn't enough. And so what could we learn as obstetricians, as emergency medicine physicians, as physicians in general, and healthcare providers in general? What can we learn to be better able to translate the science into better actionable measures for our patients? So I think, with climate change and with vaccines, we're seeing an imperative that science communication take greater steps in being able to convey messages that are vital for people to hear and understand.
I think actually your communication skills are excellent, so don't say that. But I totally agree. We've been translating to mom information for, about everything that's medical for years and years and years. And it really is important, to put it from a mom's perspective, in a mom's language, not to dumb it down.
No.
But to make it, actionable, as you said, practical, realistic, and take into account, as Donna said, we don't have time for this. Like we got to hear it fast and we got to process it fast. And then, hopefully no one will, be on our Facebook saying something different 2 minutes from now. But what about you other guys? What do you think?
So I agree with Jane especially with what's been said. I think it's not part of our medical education training, especially when it comes to communicating with patients. And for me, I think everybody loves stories, like Heidi, the way you tell it, right? And I just say, usually I share my own story, especially with the pregnancy when I've been doing that. And it's kind of what motivated me. And I think also I really do worry about what you said, with the low vaccine uptake for HPV and other vaccinations. And I tell a story of somebody who grew up in a poor country, of witnessing people with polio, people with infectious diseases. We've been people from lower and middle income countries can tell you how their lives have changed because they had access to vaccine. And I think that's also, this generation, especially millennial generation, and the U.S., did not see what polio was like, what infectious disease spread looked like. So I think listening to stories from parents, grandparents, those are very, very important, I think, in the way we communicate. And also, I think over time, just not only the infectious diseases, but also non-infectious diseases like non-communicable diseases.
Yes.
It's worse in during this pandemic, right? People are less active.
Yes.
Also the mental health, right? So there's a lot of things that worry me and keep me up at night, Heidi. Just not this to add to the matter. But
great. Oh my goodness.
I'm hopeful that there'll be something. And I'm sorry, Donna, for interrupting you, but I think there's a lot to be said about this topic in general, but also many other things because of this pandemic. And we're so ready for this pandemic to be over, and we have the solution for it, the vaccine. And I think it's important we get that.
I think we have like 4 other summits that we have to do. But in the meantime, I want to thank you all. Thank everyone for watching. Public health is personal to all of us. And that's because there's nothing better than the greater good. A healthy community can nurture a healthier future for all of us, and especially the little ones that we love. Just remember, we can't do this alone, but we can do this together. So everybody, let's go out and do it. Thank you, everybody.
Thank you.
Hey, guys.
Sorry, I was in a different meeting. I'm getting.
Hi, I'm Dr. Gerald Harmon, President of the American Medical Association. As a family physician and frontline responder to COVID-19, I know this: being fully vaccinated is the best way we can protect ourselves and our loved ones from this virus and its variants. While vaccinated people can develop COVID-19, they are much less likely to experience a severe case or need hospitalization. Since December of 2020, nearly 2 out of 3 people in the United States have been fully vaccinated against COVID-19. But our work isn't done. Sadly, we're now closing in on 1 million lives lost from COVID. With the BA.2 Omicron variant on the move and the possibility of more variants in the future, we need to reach out to those who have not yet been vaccinated in order to save lives. Every physician in America has an important role to play in promoting vaccine adoption. And that begins with the power of example. An AMA survey showed that by June of last year, 96% of practicing doctors were fully vaccinated. And particularly among marginalized communities with historically well-founded mistrust of medical institutions, the power of example is an important step towards rebuilding trust. Experience has shown us that patients place great faith in a strong, positive recommendation from a physician. I know this firsthand. Patients have come to me with questions and concerns about vaccines, and I've been able to reassure them that they are safe and effective. I tell them, you take my advice when you have a broken bone or high blood pressure or many other serious illnesses. Take my advice on this. Get the vaccine. The results are proven. Information, education provided by physicians and other healthcare professionals leads to higher vaccine acceptance rates. At the AMA, we encourage all doctors, regardless of specialty, to encourage their patients to be vaccinated. We have a number of resources on our website to assist with frequently asked questions, along with evidence-based messaging guidance and best practices for communicating with patients and fighting misinformation. The campaign to vaccinate the entire nation is a long and ambitious undertaking, but it's a very worthwhile one. Through summits like this, we can learn more about vaccine hesitancy among particular groups and our respective roles in responding to COVID-19, and we can renew our collective promise to get more people fully vaccinated. I have been and remain committed to this mission, and I know you are too. Thank you.
Thank you, Dr. Harmon, for sharing your perspective on the importance of COVID-19 vaccinations. We know that medical professionals have been fighting tirelessly on the front lines through this whole pandemic, and without their efforts, we would not be where we are today. Thank you, Dr. Harmon and the American Medical Association, for all that you do and all that you have done and continue to do. I'm very excited to introduce our final panel, Getting Young Adults Vaccinated and Boosted. This conversation will feature innovative ways to get young adults vaccinated and boosted. We will have doctors and young adult leaders themselves talk about their experiences, and we are excited to welcome this incredible group of experts. With that, it is my pleasure to introduce our moderator, Dr. Ada Stewart, Board Chair of the American Academy of Family Physicians. She may already be a familiar face to many of you from the We Can Do This videos we have shared throughout our summit today. As AAFP Board Chair, Dr. Stewart represents over 125,000 physicians and medical students and advocates on behalf of family physicians and patients to inspire positive change in the U.S. healthcare system. Dr. Stewart is a family physician with Cooperative Health in Columbia, South Carolina, and currently serves as lead provider and HIV specialist. Dr. Stewart has committed her career to ensuring uninsured and low-income families have access to high-quality healthcare. We are so honored to have you with us today, Dr. Stewart, to moderate this panel. And with that, I will turn it over to you.
Thank you so much. Thank you, Rochelle. This is an incredible time, and I am so honored to be able to moderate this wonderful panel and introduce the individuals who will be part of this conversation today. I want to make a note, as you talked about, me being a family physician and how important family medicine and also family physicians are in all of this, in making sure that our communities are vaccinated, that we talk to our young adults, as these individuals on our panel today will try to really talk about how best we could do this and accomplish this goal in ensuring that they become vaccinated, and if they're already vaccinated, boosted. So with that, I'll go ahead and introduce our outstanding panel today. First, I will introduce Ellie Kim, President of Vaccinate America, Penn State University. She's a third-year student studying molecular biology at the Strayer Honors College at Penn State. And since the beginning of her college career, she's been an advocate for community health by helping spread accurate information about vaccines. As president of Vaccinate America organization, she sits on the Student Wellness Advisory Board and organizes outreach events for Penn State students in local school districts. Ellie hopes to continue this mission throughout her professional training with hopes to pursue medical and graduate education. Next, Victoria Hammett. She is Deputy Director for Gen Z for Change, which is a nonprofit organization with a coalition of over 500 creators with combined following of over 500 million. Gen Z for Change leverages the power of social media to educate and mobilize Generation Z. Some of the organization's primary focus has been sharing accurate COVID-19 information on social media and encouraging young people to get vaccinated. Next, we have Robin Buchbaum. She serves as Director of Strategic Initiatives at the American College Health Association, where she oversees a CDC cooperative agreement focusing on COVID-19 vaccination and mitigation efforts on college campuses. She also serves as the liaison to the ACHA's COVID-19 Task Force, a group that has provided numerous resources and guidance documents to campuses throughout the pandemic. Next, we have Christine McGuire. She's Executive Director at Young Invincibles, a national young adult policy and advocacy organization based in Washington, D.C. She is an experienced community organizer who has spent the last decade working to empower and uplift adults from under-resourced communities as the executive director. She empowers young adults to advocate for equitable higher education, healthcare, and economic policies. As an active member of her community, Kristen is the first Black person elected to the local school board in November 2020. Her upbringing, family values, and commitment to the community ensures educational success for youth at every level and from all diverse backgrounds. And last but not least, Dr. Dara Cass. She's a native New Yorker and a board-certified emergency medicine physician whose commitment to public health and health equity informs her work at every level. She currently serves as Regional Director for Region 2 at HHS. And for the last 18 months, she has shifted focus to policy and public communication regarding the COVID-19 pandemic. She has focused her communication on the impact of COVID on communities and families, empowering Americans to make informed decisions for themselves and families. Welcome to you all, and I am so honored to have you all with us today. We're going to start this conversation with Dr. Cass. I really want to ask something that, I hear within my practice as I talk to, young adults. They want to know, they've already had COVID, or they know individuals who have had COVID and, they're doing fine. Why is it still important to get the vaccine?
So I think it's really important for us. I want to say thank you to for being here. As a member of the HHS family, as the parent of 2 children who fit within this age group, as the advisor for overnight camps and somebody that works with colleges, I think there's so much we can do about making sure that this particular group understands the power of vaccinations and boosters. I think one of the things we need to understand is that vaccination, especially that primary series, provides a real foundation for your body's response when it's exposed to this virus. We know right now that the virus is almost anywhere, especially as we get rid of some of these mitigation measures, whether it's choosing to go unmasked on any sort of transportation or trying to go to a bar for, a drink with a friend or going out to dinner. And as we really, loosen up some of our other restrictions, because we know that protection from COVID is a layered response, right? That we have a lot of tools in our toolbox. And as we get rid of some or even use them maybe more sporadically, it's really important that we have a solid foundation of protection. And that the one that travels with you, no matter where you are, the one that is ingrained in your, in your body's response to exposure is that vaccine, and especially that booster for people that are over 5 months from their mRNA primary series. And I know that, especially high school students and college students, they want to be on the move. Right? When I thought about the beginning of this pandemic and how we really tried to figure out how do we keep kids safe in environments where they're moving classes, where they're seeing so many of their peers, where they're engaging in lots of different activities, it was nearly impossible to pod up anybody over the age of 12. Right? I think that looking at this panel, I can see your faces, like you just can't restrict the activity the same way of somebody who's a young adult. And so we know that the exposures that young adults on the move, doing all the things that you need to do for your social growth, your emotional growth, your academic growth, that's really important. And we want to give you that freedom. We want to support that ability to be out there doing the great work. And if you're vaccinated, and now especially if you're boosted, your body is most prepared if you go out there and you are exposed to this virus, so that you're less likely to transmit it to somebody else. You're less likely to get infected yourself. And most importantly, if and when you do get infected and you turn positive, that course, it should be easier for you. You should be able to recover faster. The long-term consequences of COVID you're more protected from those. And so I say this, like I said, as a parent, as a community member, as a partner. Ellie and I have done some work together on vaccinating, college students and educating them. And I think that it's really important that everyone knows that it's because we want you to be free and yourselves that we fully believe that vaccination and boosting in this age group is so, so important.
Wonderful. Excellent advice. On that, Kristen, I really want to hear from you and ask you, what are you hearing? What are you hearing from the young adults as far as their concerns regarding this vaccine?
Sure. I don't think the concerns that we've heard from young people are any different from the concerns that we've heard from other age groups. With social media, it's very easy for misinformation to get out, become viral, and then become anecdotal facts in the community. So what we hear are a lot of issues about side effects, concerns about fertility, and also really just asking, if I am young and I am healthy, do I need to be vaccinated, or will I just recover as I would from any other viral cold? And what's really important there is when we think about how we address those issues. Like the doctor just said, this is a community of folks that we will not and have not been able to pod and actually do have to be social in some aspect because the very nature of where they are in their lives with going to school and working jobs. So what we have to continue to do to combat that misinformation is to challenge those beliefs in a way that comes from a place of trust, in a place of understanding, and also with facts and data. And what's important is that the information that we are providing to young adults, we also can provide resources to fact check ourselves as we speak. And really, when we think about meeting young people where they are, it's really about building that trust so that we can be the messenger to relay those pieces of information.
Wonderful. So very important about being that trusted source of information. I want to turn it over to Robin and kind of talk about, some of the, how do we really address misinformation and, all the different things that young adults are actually hearing out there. How best, what have you found that really works to address this very issue?
Yeah. Well, thanks, Dr. Stewart, for your question. First, I just want to remind everyone that while not every young adult seeks higher education, colleges and universities do touch close to 20 million young people each year. So there really is a significant role for colleges and universities. And, like you said, the amount of misinformation out there for this population cannot be underestimated. So colleges, the health centers are really critical to helping students to get that messaging. And this is not a new role for them. They are used to helping young adults become educated health consumers. But, what they're really finding is that the one-on-one interactions, we know that's effective in vaccine uptake. They also have health promotion staff. They are using peer health educators. Those peer health educators are out there tabling. They're starting conversations. They're creating, really innovative social media content. And so we know those things are working. A lot of campuses have focused on unity or community messaging. That seems to really be working. Students want to have a quote normal experience. And especially this year, that was the way to do that. We are all in it together. So that's been really critical. But correcting that misinformation by getting out there on TikTok and using memes and a lot of personal storytelling. I know TikTok sounds really, really scary, but if you've got the right people doing it and you get that organic reach, it's effective. Lots of our campuses would be, handed out T-shirts and swag. And again, that's all work that doing things that we call social norming, just making that positive peer pressure. Peers, we know peers are so influential at this age. And so making social norming part of any vaccination and mitigation campaign is really important.
I would love to have any of you all jump in on that as far as really how do we best approach this population again, with, so much as far as social media is concerned. And, as an adult, as a physician, sometimes I think I know, how best to approach this population. And, again, not being there, as one mentioned already, we have to meet this group and many others where they are. I would love to hear from Victoria, and then anyone else, just chime on in, please.
Yeah, so that's basically what Gen Z for Change does. We connect young people with accurate vaccine information and credible experts using social media. And a lot of people make fun of social media platforms like TikTok for the dancing videos or the influencers or the trends that go viral. But if we kind of put our preconceived notions about what vaccine education can look like to the side, we can see how all of these things are really useful tools in getting accurate COVID information to young people. So what Gen Z for Change has done, for example, is we actually utilized the influencer community on TikTok in order to encourage them to educate their followers about the importance of vaccines and the reality of COVID. And on top of that, we also use trending sounds and comedy skits in order to educate young people about COVID in a really entertaining way. Because, unfortunately, a lot of young people are not really tuning into the news to listen to Dr. Fauci speak about COVID or the vaccines, but they are on social media. And so what Gen Z for Change influencers did, along with a lot of other influencers, is we actually sat down with Dr. Fauci to ask him young people's questions. And then we recorded that and posted it to social media so that young people can have their questions answered on the devices that they use the most. And in total with all of this, the videos that we've tracked on TikTok that have been relaying accurate COVID information have gotten over 89 million views. And Gen Z for Change alone has educated 12 million young people on the importance of vaccines. So when looking at social media, It's definitely really important to not discredit it. And also it's important to know that it's really easy to get started. All you have to do is get started, be yourself, be transparent, and you'll see that it's young people are very receptive to that.
Wonderful, wonderful. So, Ellie, as we talk about, how do we approach different groups and where they meet them where they are, you're there on college campus, what do you find is, the best way to really see how college students in particular, consume their information, or what are you doing there?
Yeah, so one of the new things that we're trying on Penn State campus is collaborating with our university health services to host these events where students can come up and ask their questions about the COVID-19 vaccine to experts, which include our infectious disease nurse, Dr. Cass we invited over. We also had our campus advisor, Dr. Ferrari, who was an epidemiology specialist. So that one-on-one setting, or I guess it's really a Q&A panel, that setting really gave a voice to the students to voice their concerns and their individual concerns, because each student is unique in what they're worried about their health. So giving that platform to the experts and to the students to interact really helped them understand more about the COVID-19 vaccine, dispel some concerns and myths that they might have had before.
Wonderful, wonderful. So, I'm just thinking about this group that's in college, and, many individuals and, young adults are not, or attend to college, so how do we reach out to those individuals who are not within college campuses? And it's really important to recognize that the group that used to be the college student, it kind of tends to change and shift as we move forward. So really want to hear from, maybe anyone can chime in on how do we approach that group who is not on the college campus. And I think we kind of touched on to it. But, more information as far as reaching those folks who may be young adults in the workforce, that are out there just within the community. Love to hear from anyone. Just chime in.
I can hop in really quickly. So when we talk at YI about meeting young adults where they are, we mean it quite literally. So we've done really cool engagements like being at Comic-Con, for example. We've also attended Black College Expos across the state of California, where we could talk to the newest Gen Z about to enter college, as well as their parents who might be millennials, and give them information about vaccinations. We've also had a national art show in all 5 of our states, where we've had community art festivals and celebrations, where we've also had mobile vaccine units available to vaccinate participants as they come to enjoy public art displays, as well as food trucks, which brings out the community. So when we talk about meeting young people where they are, I literally mean we're at barber shops on the weekends. We are at social events that this age group is the demographic. And we also partner with local community organizations that serve this demographic as well. So we really try to practice what we preach, and we don't expect people to come to us for information. We look for places where we can go out and reach the community.
And Dr. Stewart, can I just add in one more thing about this?
Please.
Yeah. So, a lot of people who are going to be in this age group, let's say 18 to 25, 18 to 30, who work hourly, a lot of them, and they may not have as many benefits as a full-time employee for longevity. They may not even be unionized. There may be a lot more consequences to them being sick from work than somebody else, right? Meaning that if they got COVID and were out for days or even weeks, that would be an unpaid time for them. And I don't know that we spend as much time reminding them of that getting vaccinated and boosted will protect them from having, severe illness, being hospitalized, and even duration of illness, preparing their bodies for if and when they ever were to get COVID. And I think that we young people, especially young invincibles, to parrot that term, there is this perception that if I get it, my body will fight it off. I'm young, I'm fit, I have no medical problems. And we've seen over the course of the past 2 years, it's almost impossible to predict who's going to have long-term consequences of COVID, right? And these physiological changes that we've seen with people who have long COVID, and there are so many of them are young people that are now identifying with the disability community for the first time. We're realizing that they are having overwhelming fatigue or changes in their ability to regulate their blood pressure or their heart rate. I mean, these are real changes that people are dealing with. And it is altering their ability to work, engage with their families, engage with their friends. And just getting vaccinated and boosted, in addition to obviously making sure that you're responsive to community changes, that you're wearing a mask as needed, is really all you need to do as a young person to prevent that from being a factor in your lives. And I just think that it's especially important for people that are working only insofar as they depend on that salary to survive. They may be even young parents themselves, right? And so all the effects we've seen for communities as far as losing a parent, I mean, these are still the age of people that are young parents to even youngest children, hundreds of thousands of whom have lost a parent to COVID. And so I sometimes think that we disconnect the idea that those who are 18 to 30, let's say, may also be young parents or may also be in the workforce. We kind of imagine everyone as a young college student, but I kind of wanted to just bring that home, that the cost of getting COVID unprotected and unvaccinated, or even getting it a second time without getting a vaccine after your primary infection. I think that, the last thing I'll say is it is really important to get vaccinated after you've even had COVID, that in what people call natural immunity, but what I call post-infectious immunity is just not enough to give you durable protection long term. And so even if you've had COVID and you have been fortunate enough to not have any severe consequences, please get vaccinated in addition to that.
Oh my goodness, so true. I just had someone in my office just yesterday with symptoms of long COVID, a young adult. So, very spot on. So thank you so much for mentioning that. And that's something that, we don't talk enough about is, what are the things that these, our young adults are actually, afraid of, or what else should they know about this? So really thank you for bringing that home. I was thinking about, another question. We have colleges and we talk about the workforce. But again, how do we truly encourage our young people to get vaccinated? And, Ellie, again, I would love to hear from you more about what you're doing. What has truly worked for you in getting your college kids, we're still behind the 8 ball. We still don't have enough individuals vaccinated. So, as we talk about the workforce, we still are seeing individuals that are college bound that, still are saying that they're getting COVID and not getting vaccinated. So, what else can we do?
One thing that really works well for our generation is peer-to-peer messaging. As we mentioned before, our generation, we tend to listen to our peers a lot more at this stage because they're part of our social circle, and information really spreads from one person to another, kind of like a game of telephone. So really, spreading information works when you have a group of peers that have this trusted information, helping their peers get to that information. And what we're doing here at the university is we set up a new health wellness student advisory board so that students here on campus can voice their concerns about what's not working or what is working on campus. And our voices as students is carried to the people in power that can help dispel myths or spread accurate information and even resources to getting vaccines and getting the information that the students need here on campus.
Wonderful. So Robin, speaking about colleges and campuses, we know that some schools have had mandates as far as, vaccinations are concerned, and others have not. And we're still seeing, that transition from school to school. Can you give us a sense of what the landscape looks like across colleges at this particular time?
Yeah, it's an interesting question. There's been a lot of numbers thrown out in the media, especially recently. We've estimated that about 73% of college students are considered fully vaccinated this year. And when you ask about what's working, one of the things that we know is working are vaccine requirements on college campuses. And you have to remember that campuses are very interesting entities. They are, first of all, the average age of a college student is 26 now, but they're full of people with families and young children, like Dr. Cass said. We have faculty and staff. They also reside in communities. They're not in bubbles, and the communities in which they reside are very much impacted by what's happening on campus. So we know the schools that had vaccine requirements did pretty well. There's of course variations from school to school, and you could be in one town where one school has a requirement and they have 98% vaccine coverage, and the school down the road has 30%. So it really is very local. Of course, what happens next year is a little concerning. Each year schools turn over about 25% of their students, and vaccines have become so political. So, campuses are rethinking their vaccine requirement policies. That's a little worrisome to us. American College Health Association really continues to support vaccine requirements as a condition of matriculation. And we still believe that campuses should strongly recommend boosters. So we know that they work, these vaccine requirements work. So we're hoping that campuses will have that same kind of success next year.
Yeah, and it continues, as you say, to change year to year as we open up. Just kind of piggybacking on that particular question, how should students who are learning in person, feel about their risk of returning to school as they return in the fall?
It really is, it depends. It's a combination of personal and institutional actions. And I'll leave my professional hat aside for a second. Just personally, I have a son who is college bound next year. He very much made decisions based on vaccine policy because he is considered high risk. So everyone has to make their own personal risk assessment, but then they need to look at the institution. How did that institution handle COVID? Did they have policies that align with my values? But, campuses that did well this year, they had high vaccine coverage, and they had transparent policies that they communicated to students and families. I think all those things are important. Campuses, more than anything, need to be able to pivot when necessary. And we're seeing that actually right now. Campuses have, they have increased case counts. They have noticed spikes in their wastewater surveillance. And those campuses are reinstating some mitigation efforts, and that's really important. But of course, any student who is at high risk or lives with a person who's elderly or immunocompromised, they have to make those decisions for themselves. And they can also work with the school, the student health center, and the Office of either Disability or Student Success, because there are things that a campus can do to help reduce that personal risk.
Well, I can't believe our time is coming to an end already. This has been awesome. So I want to ask a final question of each and every one of you all as we close. What do you think is one key message, and I want everyone to answer this, one key message that trusted messengers like yourselves need to focus on to get young adults vaccinated, and talk about the importance of vaccination and also boostering. So I'll go by my screen here. Elliot, you first, please.
Yeah, so as I mentioned before, I really think we should be emphasizing peer-to-peer messaging in collaboration with the experts who have that reliable information to share. So if there are any college students around America that are interested in advocating for COVID-19 vaccines, I do really encourage you to reach out to your local university health services to have a panel or an event where you can gather students and a group of experts so that the students can have some one-on-one time to ask questions about the vaccine, about what they're worried about.
Awesome. Next, Victoria.
Yeah, so I would say the most important thing is just making the reality of COVID very real to young people. A lot of young people think that it will not affect them, but it's important to remind young people.
With President Biden, I had a chance to visit with the Prime Minister before Russia's aggression against Ukraine, and I'm very pleased to be able to receive you now here. I think this is the first visit since the Russian aggression by a senior official of the Ukrainian government. Further evidence that a